Hello, class. Today we'll be discussing systematic caseload management, burnout, and stress management. One thing that I would like to definitely state to you is that self-care is paramount. In any helping service field, self-care is paramount no matter what you're doing, to be honest. If you can't take care of you, then how are you able to assist someone else? Your workload. How to work with more than one case at a time can be problematic at times. How to select which case to work. How to move from one case to another. How to establish a system to ensure movement of all cases. How to meet objectives has to be established. There are 3 essential skills for successful caseload managers. 1 is planning, excellent planning. 2, excellent managing. And 3, excellent evaluating. Now, I use the word excellent in front of them, but I want to change that, and I want you to think of it this way, as a healthy balance. Having a healthy balance between the 3. Okay? Balance. Balance is something that we need in our lives. Balance is something that we need in every aspect of our lives. If one thing is out of sync, then it has an effect on another part of your body, your mind, and your soul. Now, when it comes to planning, what and how? What are you going to plan? How are you going to plan it? The first thing is that you must have goals. Goals helps in the decision-making process with like 2 steps. There are 2 steps that you should use. 1, selecting the goal to be achieved. 2, determining the order in which goals should be addressed. That's where sometimes you get into somewhat of a bit of a conundrum, because you're thinking that this thing is way more important than that thing. Do I work on this case that I promised the client that I would have ready and an answer on by the end of the day? Do I work on this other case that's come through and the individuals indicated they have an emergency? Do I work on something that my supervisor has informed me that I need to have completed by the end of the week, and today is Tuesday? Goals. Selecting the goal to be achieved. Determining the order in which goals should be addressed. Now, if your goal is to have all of these things, all of these issues addressed within a 3-day period, which would be if you start on Tuesday and you want it completed by Friday, then you have to sort out which is more important when it comes to the time. Now, functions. What are the functions of the rehabilitation counselor? 1, there's the intake interviewing, the information collection and dissemination task associated with initiating the client into the rehabilitation process. You've already completed one of those. How did that work for you? Was it time consuming completing the case note for that? Imagine if you had to interview that individual and take notes and try to remember some of the things that you talked about. Well, how would that be for you? Or maybe having to transcribe just in case you recorded it, if you had to transcribe a tape. How do you think that would be? Counseling and rehabilitation. What is that? The identification of medical, psychological, and vocational evaluations. The processing of information with the client, and the joint determination of the major rehabilitation goal, intermediate goals, and the goal attainment assessment process. You've gone through this when we developed or when you developed the individualized plan of employment. Arranging, coordinating, or purchasing rehabilitation services. Tasks through which the rehabilitation plan is implemented, including services such as training, physical restoration, transportation, and housing. Placement and follow through. The task associated with the employment process. For example, job placement, job analysis, job development, follow up after placement and employment or independent living. Then there's monitoring and problem solving, collecting information on client service programs and assisting in solving problems that occur in the process. In addition, you have other tasks such as paying attention to business management, which is like some other things that we'll discuss as we proceed. We're looking at business management. Some states require that counselors manage their finances. And when I worked for the state of Texas, we were given a budget for each caseload. We were required to monitor the amount of funds that we had available for client services. And if we felt like we were getting to a point to where the money was low, then we had to make a request that we get additional funding. Some individuals there was a person in the office that would actually manage that task of seeing who had monies available and see if they can move some of those things around. You have to be very careful with that because sometimes when you're in there and you're working and you just want to get your cases processed in a timely manner, you think, okay, well, I'm writing this information up. I've already indicated to the consumer we're going to buy this prosthetic, and this is probably your fourth or fifth plan that you've written, and you haven't paid attention to your funds. If you promise the individual something, then you go in there and you find out you don't have the monies, then that's going to be a little problem. You're definitely going to encounter some issues there. Personnel management. Now, when it comes to personnel management tasks are an important part of the rehabilitation counselor's job because they usually have administrative assistants or aides. We call them RCAs, Rehabilitation Counselor Associates in Louisiana, and they had a similar title in Texas. The counselor usually have to complete annual evaluations or supervise these individuals in some states, or you have some input in the evaluation of the person. So sometimes you will, but you more than likely won't do all the hiring and firing. In some states, you will interview them. In some states, you will meet them because they're interviewed by someone else, but you will meet them and have an opportunity to kind of pick who the person might be in some cases. Case recording and reporting. Case recording and reporting tasks clearly place great demands on the counselor's time. Case recording is a requirement of the professional and serves various functions pertaining to the needs of both the counselor and other professionals involved in the case. State agency field counselors has mandated case reporting tasks, frequently originating from policies and regulations adopted at the federal level. Counselor reports activities to other community service providers participating in the rehabilitation process. Case processing and other related activities. Sometimes your support staff person will assist you with those particular tasks. And you also have software, case management software that you'll use. Time management. I must tell you, sometimes we think we can do it all, and we want to do it all because we have the heart to help the individuals that we are serving. But things can get out of hand when you have large caseloads and things of that nature that you're working within or you've been assigned. But time management is the most important and limiting factor in case management, managing your time. The big deal here is that your time management is associated with the primary functions of your job. The primary function, which we've actually gone through some of those things, and I'm going to discuss them a little more detail. Time requirements. How much time is required for each particular step? Intake interviewing. Now, the book indicates that most will consume at least 1 hour, but I've had experiences where they could last from 45 minutes to 2 hours. It's according to how much information that you're collecting. Because when you have individuals that come in with multiple diagnoses, you're trying to collect as much information as you can. And some individuals might come in a bit disorganized, and you have issues with that, trying to work around that. But the book says allocate at least 1 hour. For counseling and planning, at least 1 hour for processing of information, and 1 hour, an additional hour, for reviewing of the information with the client. Arranging coordination and purchasing services. Some agencies have support staff that will complete this task. Otherwise, allot at least 30 minutes following the intake to make these arrangements. Because you remember, you might have to schedule doctor's appointments and things of that nature. It's according to where you're working and what agency or what state you're working within. Job placement and follow-up. Job placement and follow-up. The book recommends 1 hour per client per month. If not, if you haven't contracted these services out. And when I say contracted these services out, you might have a job placement specialist within the agency, or you may have a job placement specialist that has a business, and you pay for them to provide this particular service for you, especially when it comes to supported employment. You're definitely going to contract that out. So there's a possibility you might spend some time, but I don't see you doing an hour per month per client. Evaluation. Evaluation, you're monitoring, judging, and changing. Evaluation, here you're looking at reviewing services you want to make sure that the case services funds are being used appropriately and the individual client is progressing as expected. Managers evaluate in terms of accomplishing case service goals and policy compliance. That's something that you have to pay attention to also, because you might have someone in quality assurance that might come in and decide that they want to audit your caseload or review some of your cases. Evaluation, preferably on a weekly basis, but that's not always easy to do, because some are going to have very, very active caseloads with a large number of individuals in the case load. So sometimes that becomes a bit problematic. Then, one thing that I want to indicate, for those difficult problems and unmet goals, they might require some initial consultation. You're going to always consult with your not your professor, your supervisor on some things. Maybe you can call your professor too. You're going to always consult with your supervisor on some issues, and definitely consult with your supervisor if you need to know the company's protocol and how to manage difficult cases, or if you want to send the case to a medical consultant. Technology and case management. Now, case management has changed over the years. There's now new computer-assisted caseload management software and technology available. You've been looking at some of the forms that are part of the Aware Smile system that's used in Alabama. You see how they print out, but the screen is going to look a little different when you're capturing the information from the consumer or the client. State agencies now have the software that contains 4 particular modules. That's general utility, expert consultation, feasibility determination, vocational planning, and placement. General utility, they have policy reminders, form writer, and calendar programs. That's generally what's included in general utility. Expert consultation, when there are disability related and other variables. Feasibility determination. Clinical and statistical outcome predictors and interventions. And vocational planning and placement, which is job matching and analysis. Case recording and billing software programs are now commonplace in public and private sector rehabilitation settings. These particular computer-assisted counseling programs are available as a widely marketed computer-assisted career guidance and exploration programs. The concern that many individuals have or had is that they didn't receive the adequate training for the software systems. I can tell you, when I started working as a vocational rehabilitation counselor, we had recorders and we had a lot of paperwork. There were a lot of papers. We had to complete some things, handwrite them, or dictate them and have the support staff type those things up. And then we got the case management software, which was introduced to us as a way of streamlining the process. But we had to learn all of that new technology. Now, I can tell you, once I learned it, I found it to be efficient, but I still had the long case notes that I had to include. It made for pretty cases, but I guess it helped somewhere along the way as far as time consumption. But wait, there's more. Dr. Maiden's things that you should know. Burnout. What is burnout? To stop burning from lack of fuel, to wear out, or to become inoperative as the result of heat or friction, to become exhausted, especially as a result of overwork or dissipation. This happens at times. That's the definition of the American Heritage Dictionary on English. Causes of burnout. Causes of burnout could be ambiguity, making decisions without certainty. Examples are deciding if you have all the evaluations you need, with more and more emphasis on accountability. Supervisors, attorneys, quality review staff, etc. may second guess the counselor's decision, but the decision still will be made. Incomplete job or incomplete job task. Incomplete job task. Counselors are required to do many things, some of which seem to be completely simultaneously. The supervisor wants to report immediately there's an emergency phone call. Your client is acting up in the waiting room, and you having a meeting across town in 15 minutes. Other examples, never bring a case to fruition because it is complicated and may take years to complete. Never ever bring a case to fruition because it is complicated and take many years. It may take many years complete. That's something you have to consult about. Futility syndrome. This is working with people with terminal illness can cause difficulty for counselors who have difficulty coping with failure or disappointment. Then there's the whole quantity versus quality conundrum. You may feel you know what would be the best job for your client, but immediately acceptable employment in a lesser job is available. You get evaluated on the number, but not the quality of closures. This conflict can be demoralizing. You want to find quality placements, but supervision problems. Counselors see themselves as professionals, yet are sometimes supervised as if they were not. With more and more emphasis on accountability, supervisors, attorneys, quality review staff, etc., may second guess the counselor's decisions. Now, emphasis can sometimes be a good case noting. Cover your behind. Discrepancies between job expectations and job reality. People become counselors to help others, yet the job requires many clerical activities. In pre-service, we encourage you to have high expectations. You are seeking the optimum, not enough to get by in the field. Your agency may view quality differently. This is not to say that they are wrong. It only means that they have different sets of priorities. Keeping administrators happy that are valid and important in these settings. Changing the environment. Ways of combating burnout. Changing the environment is often easier said than done, but it can be done. Now, the authors recommend changing the social, psychological, and organizational environment. Changing the social and psychological environment may be easier than changing the organizational environment, at least short term. If you are in a large organization, this may be more difficult for you as a counselor. Usually the supervisor or the administrator is responsible for setting the organizational goals and culture. They also recommend emphasizing professionalism by emphasizing professional development. I would heartily encourage such effort, but there is resistance. Many counselors do not emphasize the professional aspects of their jobs. Many do not belong to professional organizations. Even fewer read the professional journals if they do not belong. Nevertheless, just because the problem is difficult doesn't mean that you don't have to try. You're looking at increasing your professionalism and also just increasing participation and autonomy. Self-renewal. You'll be working with people who will not succeed, even die from the disease that causes their disability. Counselors need other activities in their lives than their jobs. They need friends, family, and other interests. Take up astronomy, gardening, playing music, exercise, writing. Get a life. Get a life. Learn how to handle some of these job stressors. Self-renewal, 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 self-renewal. Again, get a life. Time wasters. Time wasters. Doing too much at once, inability to say no, procrastination, complaining, fear of failure, fear of success. Time wasters. If you think you have too much to do, you probably do. Learning not to do too much at once means doing fewer things at one time, or doing one thing at one time, concentrating on what you're doing. Saying no means deciding what are your needs and limits, and then saying no to whatever else interferes. Tell the truth. Express your gratitude. Maybe suggest someone else. Write the letters no on your phone in big letters. Don't say maybe when you mean no. Okay? Procrastination is one of the biggest problems. The text lists it as the most difficult problem in time management, procrastination. We do it, we do it. We say we're going to get to it, and then some people say, well, I work best under stress and under pressure. That doesn't work all the time. Ellis and Noss list 3 reasons for procrastination: putting oneself down, self-downing, low frustration tolerance, depression and hopelessness, and hostility, anger and resentment. Now, when we look at complaining, complaining may be a means of gaining sympathy or control of a situation. It not only wastes time, it creates a poor image of you. Solution here: listen more to what others say, and you may see your complaints are petty. Try ways other than complaining to overcome your problems. Try accentuating the positive. Ask yourself, am I complaining to get attention? If so, find a more effective alternative. Fear of failure. Try doing all that you can to ensure success. Reevaluate how your view of failure is. Imagine the worst consequences, then see if you can stand them. Each experience allows you to stand future mistakes. Fear of success. Fantasize about what would happen if you were successful. Will others be jealous? Would you behave differently? Just additional time wasters, devaluing your work or overvaluing your work. Your achievements can be dealt with by honestly appraising your efforts. Remember, most efforts fall into the good but not great category. Perfectionism means rethinking your entire approach. It will lead to failure because no one can be perfect all the time. Are anorexics perfectionists? Seeking the perfect body? That's a question. Are they? Try delegating authority. Be more flexible. Impatience can cause you not to concentrate on the here and now. Low frustration tolerance can cause you to never finish anything because you give up too easily. And then there are emotional afflictions that may be causing problems for you. Other time wasters. Jealousy. Jealousy pinpoint what you value. Try to learn what the other person did and learn to do it too. Inability to take criticism can lead to self-hate. Learn how to take criticism. Learn how to give it. Make a list of everything you do well and get away from the negatives. What do you think is your biggest time waster? Commuting and travel time. Being careful with that. Being careful with that. Commuting and travel time. Are you traveling too far? Are you going out when when you're working with a consumer, you might be doing something in the field? What do? Do you have them come in to see you? Or do you spend a lot of your time going over to meet with them just to get them to sign a document? The terrible twos: telephones and television. Telephones and television. Telephones and television. How many times can I say that? They are definitely time wasters because you'll get on them, or you'll get on your telephone, or you'll start watching television, and before you know it, the time has passed. An hour's gone by, and you're rushing trying to do some things. Bad habits. That's another time waster. Again, what do you think is your biggest waste of time? How are you going to reduce or eliminate that time waster in your life? One of the things that I found most effective was a to-do list. Work from your goal list, develop daily priorities to meet your goals, estimate the amount of time, and create a personal planning calendar if you have the time. This is something that I found to be very, very effective. Because if you write down your to-do list, the things that you have to do that week, then you can just check them off as you go and you can see. And then you can go back and you rearrange. them by priority. If something comes up, then at least you'll still know what you have in front of you. Okay? And that's it for this lecture. If you have any questions, post them and ask the instructor or email me.